opportunity to present HB 1346, that's using LC 620442S. And this is known as the Georgia Maternal Mental Health Improvement Act for your consideration today. Again, that's HB 1346 using LC 620442S. Before I speak as a legislator, I want to speak to you as a mother. I remember what it felt like to hold my baby for the first time. The joy, the exhaustion, the overwhelming sense of responsibility. And like so many women, I also remember the moments of anxiety that I did not expect. Moments where I questioned whether I had done enough or whether I was enough. Now imagine experiencing that not as a passing moment, but as something deeper, something persistent, something debilitating. And imagine not being prepared, not being asked, and not being helped. For far too many women in Georgia, that is not hypothetical, it is reality. In Georgia, the data is sobering. Georgia has the second highest maternal mortality rate in the nation, 66.3 deaths per 100,000 live births. That is more than double the national rate. For the period between 2018 and 2020, mental health conditions, excluding substance abuse disorders, at least probably contributed to 18% of pregnancy-related deaths in our state. When substance use is included, the impact is even greater. The Georgia Maternal Mortality Review Committee has found that more than 60% of pregnancy-related deaths are preventable. A 2017 survey showed that more than half of new mothers in Georgia reported feeling quote unquote down, depressed, or hopeless. The bill responds to those facts with structure, accountability, and common sense. That's why I introduced House Bill 1346. This is not a new program built from scratch. This is not a mandate. It is a structured, evidence-based system to ensure mothers are screened, referred, and treated early, before depression becomes crisis, before anxiety becomes hospitalization, and before children suffer lifelong developmental harm. That is responsible governance. Now let's talk about fiscal impact. Early intervention reduces crisis care. Prevention reduces high-cost emergency services, and that's smart policy. This legislation does not create partisan division. It creates opportunity for consensus. Maternal mental health affects Republican families, Democratic families, and independent families alike. It affects rural counties, suburban, and urban centers. It affects every community in Georgia. This bill is about protecting life, not just at birth, but after birth. It is about acknowledging that mental health is health. It is about ensuring that no mother in Georgia suffers in silence when early, low-cost screening and treatment could change the trajectory of her life and her child's life. I respectfully ask for your favorable consideration of House Bill 1346, and thank you, Chairman and Committee.
That was a very fine presentation.
Thank you.
How long have you been in the House?
I just got here last year.
I know. That's very good. Congratulations.
Thank you.
Okay, I got a couple lights here. Who's six? I don't know. Okay.
Thank you, Mr. Chairman.
Representative Schofield, go ahead.
Thank you, Mr. Chairman. Thank you, Representative Jones. This is a great bill, much needed and timely. I just have one quick question. Is there a fiscal note?
There is no fiscal note.
Okay. Because on line 157 says it's subject to appropriations by the General Assembly.
The reason why there is no physical impact is because it is subject to appropriations. We're trying to do a 3-year pilot program for only high risk places as well as rural communities if it is appropriated. So that means that we don't have a risk to our fiscal budget if this is something that is not adopted in our annual budget review.
Follow up. How much are you asking for?
Well, at this particular time, when we were looking at the numbers, we were actually looking at it being a very low cost because a screening of this magnitude could, when we did our research, looked like it was going to be maybe about $85 to $100 for this screening. However, what our goal is with this is for it to open it up for Medicaid recipients, and that the Department of Community Health would implement those screening protocols and those referral pathways, as well as get the Medicaid, open it up in the Medicaid as relates to the Department of Health and Human Services on the federal level. That is our main goal, is make sure that when those women that are impacted by this, as it relates to physicians determining that it is medically necessary, that they are able to get remunerated for the services that they have provided.
Thank you.
Mm-hmm.
Representative Mitchell. Representative Mitchell.
At the appropriate time, Mr. Chair, I wanted to make a motion.
Well, we've got a couple more questions ahead of you, so but hang on to that idea. Chairman Newton.
Thank you, Mr. Chairman. And,
Oh, okay.
thank you, and thank you so much for the bill. Certainly, maternal mortality is one area that we've been working on for several years and trying to make progress in Georgia. Also, but short of mortality, there's a lot of morbidity, which is just illness associated. And I really appreciate the fact that this is pointing a spotlight on something that often gets missed with postpartum depression. The challenges that come with maybe having one young child and now a newborn as well, or even more than that, trying to manage, I think, remote availability of doing the mental health screening is a key part, and I certainly will strongly support this from the funding side as it gets to that effort as well, but pointing a spotlight at that, and plus the fact that this body has expanded the Medicaid and made it available to women for a full 12 months after. We got that waiver over several years working hard. We got to 6 months, and then we got to 12 months, and that's really the amount of time that's needed to get on the, whether it's monthly medications or 3-month medications, shots, whatever alternatives there are. I just really appreciate the bill, and thank you for bringing it.
Thank you so much.
I don't see any other questions. Oh, you've got one? Okay. Chairman Petrie.
Thank you, Chairman. And I agree with Dr. Newton. Obviously, there's nothing more important than making sure we protect children, and we can't protect children without making sure they have healthy mothers. So my question is this: as I read through here, and I only have the experiences in my life with my wife and now my daughter. I have 4 grandchildren. So most of what I see in here, one would expect that a physician that is an obstetrician who's working with a woman through birth and so forth and following up with them, whoever their physician, that they would already be doing these things. That they would already be getting this type. They would be looking for these. They would be assessing always for most of what is in here. Is that not the case typically? Because I know in my family's experiences, there's a relationship there that you develop with your physician, and physicians generally care about their patients and they want them to thrive. And so why is it that we aren't getting this? Because what you're ensuring is that those physicians are doing these things, touching these bases. Are they not doing that? Obviously not. And why is that? I don't quite understand that.
All right, thank you for the question. I believe that this was really more about standardizing screening intervals and requiring measurable accountability and not making it a mandate on physicians whether or not it's something that had to be done every single time with a patient. It was really about what was going to be done if they deemed it medically necessity to be able to move forward with doing it long term. Sometimes you have women that do not start getting treatment or for care as a pregnant person until long after they're in middle term of pregnancy. Sometimes you don't get that touch point early. And those that are able to do that, I commend them on being healthy mothers from the start of pregnancy. But sometimes it doesn't happen like that. Sometimes there are women that are getting care from the free clinic. Sometimes they're getting health care from the health department. So you have so many different avenues of care that may not look like the image of care that we may receive in our own homes. So we wanted to make sure that, number one, we weren't mandating the physicians that do have the scope of practice to be able to do this. And then also we wanted to make sure that they had the autonomy to be able to refer to another healthcare provider that was trained to do this, because if they're doing other work in their office, they can now refer this to a mental health counselor or a social worker, someone else that may have those skills to be able to still identify through these screenings and get moms the help that they need sooner than later. This is really a twofold thing that we're doing, because I really believe that when we have a strong mother, we have a strong family. When we have a strong family, we now have children that are able to be productive citizens here in our state and be able to provide back to our tax roll. That is where I am with this, just making sure that we're giving everybody the developmental tools that they need to be able to be productive and create productive citizens for our state, so that we're able to now not have to worry about having them on what I'm trying to say, we don't have to pay for them to be able to live, because now they will have the tools to be able to do that for themselves.
All right, thank you.
Thank you.
Representative Mitchell, you're up.
Mr. Chairman, I didn't get a chance to sign up, but just real briefly.
Yeah, okay.
Stan Edge on behalf of the Georgia OBGYN Society. We worked very closely with the representative to perfect this legislation. She has been great to work with. We think this is a very positive step for Georgia, and we support the bill.
Thank you. All right. All right, Representative Mitchell, you're up.
Thank you, Mr. Chairman. I move do pass.
All those in favor say aye.
Aye.
All those against say nay. Congratulations, Representative. You have your first bill. Way to go. All right. Okay, up next.